Thank you. Thanks, Minerva. I don't remember that gig with the guitar and the kneecap, but
I've got the picture.
Yeah, like Anthony Weiner, you got the picture. So I can't really deny it. So I won't deny it. Anyhow, thank you everybody for being here tonight. Thank you, Santa Clarita Valley Democratic Club and Minerva and Todd so much, and a lot of you I know already. Some of you I don't. Steve Brooks from Progressive Democrats, LA chapter. Thank you for being here too. My name is Bill Honigman. I always start with, hi everybody. Hello. There you go. So one more time. Hi everybody. Hi Dr. Bill. There you go. So make sure we're all energized and ready to go here. Fired up and ready to go, right? Yeah, I'm going to add a few things. I was very glad that Dr. Gene presented his case for Medicare for All. So I'm going to give you facts and figures. And Minerva mentioned we have to base our arguments for reform on facts and figures, on data, on hard, cold data. Joe presented also very compelling in the cancer research and the stories about other countries, very compelling stories and really heartfelt stories for the case for economic and social justice. And we may or may not feel we need that or have to or see the crisis, like Dr. Joe does, see the crisis every day in what she does. I'm an emergency room physician. I'm on the front lines. When people fail in the system otherwise, they end up in the ER. And if you have an emergency, you end up in the ER along with all those people who just failed in the system. It's been that way for a long time in this country, and there are certain parts of our system that allow that to happen, in fact, breed it, and that's because there's a whole lot of money involved. So I'm going to start with a little story and then show you some slides that I think are very, very compelling. First of all, I didn't have enough for every seat, but at every table there should be a flyer that looks like this, which is from Senator Mark Leno's office on SB 810, which is the new single-payer bill for California. And it has a couple of the graphics that I'm going to use here, very compelling. But it also has a very strong economic argument, and it goes a little like this. Who here can tell me what single-payer is in 3 words or less? Dr. Gene.
Medicare.
Medicare for all. Okay, that was supposed to be an easy question. Okay, here's the harder one. Who can tell me in 3 years, in 3 words or less, what the public option is?
We're screwed.
And I would propose that it's Medicare for all when it's the most robust public option. Remember that term, robust public option. So that means that the insurance companies would still be in existence and would compete with a public plan based on certain things that the government could throw in there as incentive to belong to the public plan. And then the private plans would have to compete. Okay? And I'll start with a little story. I am a Democratic Party activist, very proud of that. I have been all my life, and I feel the Democratic Party supports the issues and the social and economic justice and the issue of peace, especially that I personally support and have all my life. I think all politics or all issues are political ultimately, and I think you have to take a side. Not always. You don't have to declare yourself of one party or another. I organized for a group called Progressive Democrats of America, PDA, and most of you have the green and blue sticker on your body at this point or in your pocket that says windmills, not weapons. We have another one I ran out of. It says healthcare, not warfare. You might have heard of that expression before. But it's a question of choice. It's a question of priorities. So we could have healthcare, not warfare. We could have education, not warfare. We could have energy conversion, not warfare. And there are progressive Democrats in Congress, in local office, that you can support that will vote that way. So we have Greens, we have Independents, not too many Republicans, but some of them. I live in Orange County. I'm willing to talk to Republicans. I do all the time. So I invite you to be a part of our organization. You can reach me at Progressive Democrats of America website. That's on your sticker, Dr. Bill at pdamerica.org. You can reach me at any time. I'd be glad to send you this PowerPoint. I'm going to show you some slides very quickly here that unfortunately, usually I have longer to present, but not 45 minutes, more like 15 minutes, but I'll try and do it in 10 minutes. And you may have questions afterwards. You can feel free to contact me that way. Little story, I was campaigning for my candidate in Orange County this last time, Loretta Sanchez. Anyone know her? She's a good person. She's a Blue Dog. Not real happy with that, but she often votes our way, but she is a member of the Blue Dog Caucus. So none other than former President Bill Clinton comes out to support her at a rally on the courthouse steps in Santa Ana. So being on our county central committee, I get priority seating, or standing, I guess, where I can stand in the front. I don't stand up behind the candidates because, you know, those are what they call the butt seats. Because all you can see is their butts when they're talking. So don't take the butt seats, but I did take a standing position in the front, and was able to shake Bill Clinton's hand. And I thought, you know, I hadn't been able to do that before, and I thought, I'm not going to just shake his hand, I'm going to ask him a question. So I asked Bill Clinton, I said, Mr. President, when are we going to have single payer? And I wore my white jacket. He knew I was a medical person, or, you know, at least maybe one of the village people in disguise. But so he stands there and he lectures me on the subject for about 3 minutes, and everybody around me said, wow, he talked to you for a long time. And I went, you know, yeah, it was great. The bottom line was, he said, we're going to have single payer. He says, we're getting there. He says, we're going to have it when businesses understand how much money they're going to save. And that's one of those graphics on that little flyer right there, is how much small businesses especially save money per employee, and then big businesses too, which are a little less likely to go with this because they're tied in with other big businesses, as you'll see. So that was Bill Clinton's perspective. A week later, I get to ask the same question of Barack Obama. At the rally at USC, I did the same thing again. I wore the white jacket and I snuck in with the UC Irvine Democratic Club students. They had the butt seats, but I stayed in the front there where I could shake his hand. And I got to ask Barack Obama the same question. I said, Mr. President, when are we going to have single payer? And he said, we're taking it step by step, and we have to protect the gains we've already made. And that's, you know, Bill Clinton's the consummate corporatist, in my opinion, and then Barack Obama is an incrementalist. He wants to take this baby steps little by little, or what some people call the practical progressive. Well, I'm going to present a case to you that, like Joe says, we don't have time to deliver the baby, you know, part by part. We're in a crisis situation in healthcare. And like Dr. King said, it's all about the fierce urgency of now. So this data, you could switch, sorry if you didn't get to read that, is compiled by a group called Physicians for National Health Plan, or Health Program. If you don't know them already, they've been around 30 years or more. They are physician academics, largely, or was founded by physician academics at the Harvard Medical School of Public Health. No bunch of slouches here, okay? This is compiled data that they use to come up with things like how we're doing compared to other countries. For example, how much does healthcare cost in this country compared to other industrialized nations? Anyone know how much more we spend on healthcare than other industrialized nations? Twice as much. And for that, what position are we in the world standing in, say, in terms of outcomes?
37.
We're number 37. All right. We're not 36, we're 37. We're trying to be 36. If you're 37th, you're about tied with Slovenia. So if people say we have the best healthcare in the world, that's not true. Slovenia has healthcare that's as good as ours. And other countries, you know, 36 of them have better healthcare than we do. Okay? And here's the data that shows you what. Let's talk about the uninsured. Next. This was an estimate based a few years ago, 46 million people. How many people do we have in the United States of America? About 300 million people? Okay, so as many as, this number is now adjusted up to about 60 million, as many as 1 in 5, 1 in 6, 1 in 5 people walking on the street don't have any insurance at all. Next slide. And what that largely results in is this. This data, as you can see, it's footnoted at the bottom. And by the way, contact me if you want this PowerPoint, because I'm going to go fast. Was compiled in 2002. At that time, nope, thanks. At that time, what they attributed to a lack of access to a physician resulted in about 20,000 deaths per year in this country. These are avoidable deaths we're talking about. That number now, and data that's soon to be published, it was compiled in 2009, is upwards of 50,000 people. And I gave a talk recently to some at-risk youth in the city of Garden Grove who are thinking of going to college, and I asked them all, who's been to Angel Stadium? They all raised their hand. I said, anyone here know how many people are in Angel Stadium? And a bunch of them yell out, 50,000 people, or 44,500, something like that. They knew the exact number, I didn't. I said, imagine a stadium filled with people and all those people died this year because they couldn't see a doctor. And the crowd just went, whoa, So, I mean, we have to get our heads around these figures. Next, please.
Sorry.
Oh.
Second. I'll be right
Got
back.
distracted.
Yeah, there we go.
It's not just the uninsured, it's the underinsured as well. Next. This is a slide that shows percent of people who have to spend more than 10% of their disposable income for health care. And you can see the U.S. population in general, about a fifth of us will ultimately have to spend about greater than 10% of our disposable income. If you happen to be in a private non-group insurance plan, that's about 50% of those people will have to spend more than 10% of their disposable income on health care. I don't think that exists for most other sectors of the economy. Next.